Hello, this is Josh.
Josh, are you at 6000?
Yes, I am.
Great. And what company are you with?
DOMO, Domo.
Got it.
I might pop on and I got Safari or Chrome both trying to get in, but I just can't seem to get in.
Sure. So I think the best thing for you to do, because we're going to get clean audio for you on this conference line. So if you can't get the video to work, you can basically just join us via the phone.
Okay. I'll stay on here then.
And just a reminder, your phone, we have the ability to mute your phone, but because you're a speaker, we are not. So if you want to mute your phone, it's at your own phone.
Will do. I'll do that.
Hey, whose last four digits are 5112?
This is Dave Elkington.
Got it.
Okay. Good morning. We'll go ahead and start the press conference with an update on the numbers. Today, we had 482 new positive cases for a total of 3,641 positive cases. 33% of today's positive cases are related to the surveillance testing that has been done at the meat processing facilities. We had 2 new counties, Cherokee and Humboldt, for a total of 84 counties. We had 1,313 negative cases today, for a total of 23,974 negative cases. We've tested 27,615 Iowans for a per capita test of 1 out of 113 Iowans. The State Hygienic Lab has 7,273 tests available. We've had 1,293 Iowans recovered for a recovery rate of 35%. We have had an additional 4 deaths, and all 4 are related to long-term care facility outbreaks for a total of 83 deaths in Iowa. 10% of all of our positive cases in Iowa have been still related to long-term care facility outbreaks, and 51% of all deaths in Iowa are among our residents of long-term care facilities. Across all of the RMCC regions yesterday, there were 214 COVID-19 patients hospitalized. 23 were admitted in the last 24 hours. 89 patients are being treated in ICUs, and 60 are on ventilators. Also in hospitals across the state, there are 4,200 inpatient beds, 553 ICU beds, and 696 ventilators available for patient care. As Iowa and the nation prepare to reopen, the ability to conduct large-scale assessments and testing is critical to understand how prevalent the disease is and how it's evolving. The amount of data available will help us start to control the virus while making evidence-based decisions about how to ease the restrictions that have impacted our daily lives and begin to open up our businesses in a safe and responsible manner. Iowa, like all states, has had limited testing supplies and resources over the course of the pandemic. While in recent weeks our supply has increased, it was still not at the level needed to further expand our testing criteria so that more Iowans who need a test get one. And as I've said from the start with the team, we need an all-hands-on-deck approach. Iowans have seen the value of what public-private partnerships can do when times call for creative solutions. A number of Iowa-based manufacturers stepped up to help us solve our PPE shortage by reallocating their normal operations to produce gowns, masks, face shields for healthcare providers and other essential workers. At the same time, the state continued to pursue any and all sources to keep PPE flowing into our supply chain. So we've taken a similar approach in our pursuit for more testing. We've worked with our federal partners to secure additional resources as new testing technology became available, including Abbott rapid tests and serology tests to detect COVID-19 antibodies. We also worked with local healthcare providers to assist them with securing tests to be able to conduct testing in their own facilities. But there continued to be a need for more diagnostic testing to identify as many positive cases as possible to help slow the rate of transmission. And that's why today I am really pleased to be launching Test Iowa. This is a public-private partnership between the state of Iowa, NOMI Health, and the Silicon Slopes Initiative. This will make available 540,000 COVID tests to increase the state's testing capacity by up to 3,000 additional tests per day, and that's in addition to what we are already doing. And it will also help us gather critical information from Iowans that will help our health officials better target and fight the virus. Iowa is only the second state in the nation to deploy this ambitious initiative, which includes an online health assessment to determine if individuals should be tested, and drive-through testing locations where individuals are swabbed, samples are sent to a lab, and results are returned electronically within 48 to 72 hours. It's as easy as 3 simple steps. Step 1, you go to testiowa.com to complete a brief assessment that captures helpful information about symptoms or underlying conditions that you may have, as well as where you live and what your occupation is. So this type of information helps assess your eligibility for testing, and it will also help us identify potential hotspots across the state. Step 2, get tested if you currently have symptoms, have interacted with someone who has already tested positive, or have recently visited a place where COVID is more widespread. And step 3, if you test positive, we'll do the contact tracing to determine who you've been in contact with so that we can identify other potential exposures and take steps to slow the spread. We're also working to connect individuals who tested positive. We can't do this right now, but we're working to accomplish this, to connect individuals who test positive for COVID-19 to healthcare providers through a telehealth visit to ensure that they get the treatment plan that's best for them. While the assessment is an important part of the process to see if you're eligible to be tested, the information collected is critical to better understand, again, the virus activity across the state. So by taking the assessment and sharing the information, you can help us zero in on potential outbreaks and new clusters so that we can target our response and protect the health of others. Your information can also help us identify areas where minimal virus activity is occurring so that we can begin to safely reopen our state as soon as possible. The assessment, it was created in partnership with the Iowa Department of Public Health and is conducted using the highest levels of security and privacy protection available. Your information will be used only for the purpose of combating the virus until the pandemic subsides. Once you complete the assessment, you'll receive a follow-up email with information appropriate for you if you're eligible for testing. Your email will prompt you to schedule a time at a testing location near you and will also provide a QR code that you'll need at the check-in. Iowa's first testing location will open Saturday at the Iowa Events Center North Parking Lot in downtown Des Moines, and more testing sites are planned for other areas of the state and could open as soon as next week. We also will be doing a site in Tama tomorrow at a long-term care facility, so that will actually be the first site, and we'll provide more details on that tomorrow. As I mentioned, Iowa was the second state to launch this initiative. Utah was the first. And today we're fortunate to be joined by Utah business leaders who are part of a collaborative coalition known as Silicon Slopes. This group came together quickly to significantly increase COVID-19 testing capacity in their state, and now we are implementing it here. With us today, I have Mark Newman, founder and CEO of Nomi Health, Josh James, founder and CEO of Domo. Spencer Steed is the vice president with Qualtrics, and Dave Elkington of the Silicon Slopes board. So thank you all for being here with us today and for our exciting announcement. So Dave, I know Iowans want to hear more about our partnership and how this testing initiative is going in Utah and what we can expect here.
Yeah, thank you, Governor, and thank you for the opportunity to partner and deploy some of the things that have been working in Utah. So a little bit of background in terms of what the initiative was, because I think it'll be interesting for people to understand what the program was, and as we look into what it can do for the people here in Iowa. So this really came out of a partnership initially with the state of Utah, and there was about a dozen companies who came together and realized that we can't just rely on the government alone to be able to provide solutions. So we came together in a very tight partnership, and we found access both domestically and internationally to protective equipment, so PPE. We found access to the entire test capability, and then we were able to get access to very innovative and a unique set of technology that's going to facilitate up to 3,000 daily tests, as you just mentioned. And just to give you a reference, in Utah, this program has only been in place for about 2.5 weeks. And just yesterday, we were just shy of 3,000 tests. And the way the program will work is it's a hub and spoke model where throughout the state of Iowa, tents will then be set up, and drive-through capability to get access to testing will then become available. And the way, and you'll see here in just a minute, it starts with the assessment, just as you mentioned, Governor. People will then first take the assessment, and the assessment's really determining 3 categories: your symptoms, if you've got any exposure to other people who have had the COVID virus, and then third, have you traveled to any areas where that could be a hotspot? Based off of the results of that, you will then be prompted to go to one of the testing centers. So it goes through a scheduling process. The way the deployment will work is initially the test first we need everybody in the state to take the assessment, and you're going to hear more about why that's so important. Once the assessment, and we have a large group that have taken the assessment, we'll know where to set up the tents and where the hotspots potentially are. At that point, we will begin first with first responders. So throughout the state, we want to make sure that we're taking care of the people who are taking care of us. So we'll first have a phase where all first responders, all medical professionals will come in and get tested. Then it'll go through a progression of highly symptomatic to where eventually we want non-symptomatic people able to come in and be tested. And the objective here is to really get everybody back to work, back to the normal life, and really crush the curve and really get all of us back to our normal life. And so that's what we're seeing. We're again, a couple of weeks ahead in Utah, and we're beginning to see that. We've just announced here in Utah elective surgeries. So that's what we're looking forward to in Iowa. As more broad-scale testing is available through this program, it creates confidence. We can begin to work together. So with that, I'm going to hand over to Mark Newman, who is the CEO of Nomi Health. And this organization is the organization that's going to run operationally this whole program. Mark?
Yeah, thank you. Yes, and Governor Reynolds, we couldn't be more excited to partner with you in the great state of Iowa. As Dave and others have mentioned already, the key here is an open source approach to healthcare. You've seen what happens when we kind of go for other large proprietary machines, or you name it. And what was successful for Utah was mobilizing the private sector and the supply chain behind it from non-obvious sources. Everything in healthcare has changed over the last 60 days, where they buy their products, what they're trying to do, how they're trying to do it, and we've all experienced that. Traditionally in America, any single region might have been experiencing some sort of crisis, and there could be reallocation of supplies. When every region was experiencing a crisis, we all had to step up. So Utah was the test bed, and we're incredibly excited to bring this across the nation. It's obviously been reinforced many times of a hub and spoke model with TENT and centralized assessment abilities. To reiterate, our entire goal here is to rebuild the confidence of the communities to get back to work, get back to school, and living life again. And our path and our belief is that that's through massively available, abundant testing at little to no cost to any individual. That was the premise here in Utah. We're bringing that to Iowa. It has the hub and spoke model for collection and has the digital assessment piece. Another key component here is through the assessment, each individual can self-schedule their own time to show up and when it works for them, because we want to be as flexible and nimble as possible for anyone's schedule. What all of this does, from the assessment to the scheduling to the mobile tent preparation to the automation on the back end for running the test, collecting the samples, running the test, reporting results, is that drives the most efficient capacity utilization possible. That's incredibly key here. What we found was traditional tent models in states from health systems or you name it had anywhere between 100 or 150 people per day going through it. We're able to support 500, 600 people per day per location. And much like airlines with seats with planes that take off, we need to make sure that every single day that there was tests available, tests were used. The only way we can get every state back to work and living life again is through mass utilization of all of this. So we're incredibly excited to support the initiative. We're incredibly excited to support the great state of Iowa.
Thank you.
I'll pass over to Josh James, who was an instigator here on the data opportunity to be building this all out.
All right, great. Thank you so much, Mark, and thank you, Governor Reynolds. It's a real pleasure to be online with everyone here in Iowa and talk about how we can get back to work by really doing exhaustive testing and assessments and understanding where we're at and getting that information and that data. As I was talking with Governor Reynolds, that seemed to be a true pillar of the way that she manages, is making sure that we're making decisions based on information. And so it becomes very important to get that information in our hands and across her broad leadership team. And so with Domo, what we do is we take information from across the state that the state has in its databases and makes that available to the broad management team in real time. And allows that information to get out to the counties so that everyone on the front lines as well are able to understand what's going on in the state, and so that everyone can be seen from the same sheet of paper and really truly understanding this exact moment what's going on in the state. And so we're excited to be a part of that at Domo, and we're a public company, and this is what we do for big organizations across the globe. And when we're not working with governments, we're working with Fortune 100 companies. So excited to have the opportunity to help out here. One of the things that I think is really interesting is, obviously, for this to work, you have to get broad buy-in from the citizens of Iowa. And so we need awareness. And as I was talking with the governor, we talked a little bit about different ways to roll this out. And the plan that works the best is to have the governor start it. So she's going to, I know, drop a video in social media that talks about crushing the curve. It talks about really getting everyone to go to these assessments and take these assessments, so we can just understand what's going on with the citizens of Iowa. And the way that gets rolled out is with a viral campaign. So fight the virus with a viral campaign. And so you'll see that happen today, and you'll see some of the more influential and famous Iowans who are excited to help out across the entire state. And so as they receive this video and a friendly call out from the governor, then they will pass that on to their groups of followers. And I think we'll see a really cool viral campaign that really helps raise awareness to take this assessment, because again, that's the first step, is just take the assessment, and it gives the state a really good idea of where everyone's at. And again, that's only used for the state of Iowa's purposes, and that information is the state of Iowa's to the extent that individuals share that. And so we're excited to see that roll out. And the important thing is go to testiowa.com. That's the website that's up and out there right now. And if you go to testiowa.com, you'll be able to see the assessment, and in very rapid form, be able to understand kind of where you're at and get things scheduled. And so I think Spencer's on, and if Spencer is on, we'll have him jump in and talk just a little bit about the assessment.
I can't hear Spencer.
Oh, I was on mute. I
okay,
apologize.
there we
go. Thank you, Josh. Governor Reynolds, appreciate your leadership and are grateful for the opportunity to be a part of the solution. What we have found is that speed and accuracy is everything right now. And as our challenges continue to change, our ability to adapt is critical. And so, Qualtrics is a global company. We work with over 11,000 customers, including 2,800 universities. So we've been working in the state of Iowa for a long time, 8+ years, and excited to see that continue to expand. One of the important things is to be able to stay connected to citizens through the entire process, right? Whether that's from the assessment to providing results, but also checking in to see how they're doing and making sure that they're progressing. As this virus continues to change, results continue to change, it's critical that we have access at scale. And that's where the assessment starts, by providing a human sensory network to all of our citizens so that we can start reacting based on the results and hotspots that we see within the data. So, again, we're really excited. Qualtrics is more than happy to be a part of the solution, and we're grateful for the wonderful work that this team is doing to help crush the curve, and can't wait to see the results as we implement.
Thank you.
Thank you, Spencer. And so look for the campaign today from the governor. I've already seen the video that she's made, and I think it's going to be, in this kind of horrible time where we're all trying to do anything and everything we can to flatten the curve and get back to work. And, one of the big things is, again, getting the word out there to go to testiowa.com. And so I think you're going to see Ashton Kutcher and Senator Ernst and Lieutenant Governor Craig, Senator Grassley, Sports Director Keith Murphy, and then also Pastor Mike Householder and Carson King will be the folks that are going to get tagged by Governor Reynolds. So we're excited to see who they respond with and see if we can spread this throughout the state of Iowa. And again, just really excited to be helping out Domo and Qualtrics and NOMI. So look forward to working with all of you, and again, appreciate the leadership from Governor Reynolds.
Thanks, Josh. I think actually we have 2 already scheduled for Saturday. So even before we started, we got curious Iowans out there trying to figure out what's going on. So I wanted to say thanks to all of you for partnering with us on this important initiative. And the group is going to stay on, I think, if you have any questions, which you'll get an opportunity to have in just a moment. But first, I do want to encourage every Iowan to go to testiowa.com and take the assessment. And I want to especially urge those Iowans who work in the healthcare field and other essential services, especially our staff in our long-term care facilities and those who work in the food processing or other manufacturing facilities. This is an important step to protect your health, your family's health, and your fellow Iowans. The assessment takes only a minute, and if you're eligible, you could be tested as soon as Saturday, as I said, in Des Moines. More testing locations will be opening up soon, but we want to take this opportunity to be available to as many Iowans as possible. So the more Iowans who take the assessment or are tested, the more it will help us understand about the virus and the more we can do to mitigate and manage it, so we can get life and our businesses back to normal as soon as possible. So with that, we will open it up to questions.
A bunch of people get out and take the assessment today. How are they, if they're not in Des Moines where a location is going to open up Saturday, are they just being told to wait until there's like an undetermined time when they will have a facility in their area, or how does that work?
So actually what's great about it is we can schedule the test. And so as the tests come in, they'll start to look at the data and see where the majority of Iowans are at, and then we will be able to react to that. We will be able to set up in areas all across the state. As you heard, I can't remember which one was talking about this, but we're going to focus initially on our essential workforce, our healthcare workers, our first responders, our food supply chain, and some of our manufacturers. So we are encouraging hospital staff and long-term care staff to get in there and to do the assessment and get tested, and then we're going to roll that out so that more Iowans will have the opportunity to take the test, and then we can continue to schedule based on the amount that's coming in. As you heard them say, we can do up to 3,000 a day, and that's on top of our other testing capacity. So Iowans still have the opportunity to, if they're not feeling well, to contact their clinicians, to go through an assessment with them, and to take, to have access to testing capacity through that as well. But the more that we can get Iowans to go through the assessment process, it really will help us identify where the hot spots are, where we're starting to see a cluster, where we're seeing nothing happening, so that we can talk about areas of the state that are ready to go and to open up, and how we phase that in and what that looks like. So I think you heard them say Utah just yesterday hit 3,000 tests. So, we know we're not going to be there tomorrow, but we have the capacity to ramp up to that as Iowans become more familiar with it, go online, take the assessment, we'll gather the data, and then figure out how we strategize going forward with providing the testing. It also, and I'll talk about more about this tomorrow, but for instance, we're really concerned about our long-term care facilities, and so we're going to be going into Tama and setting up at a long-term care facility there, where again, we can have kind of drive the other long-term care facility staff to where we're setting up the testing site, so that they have the opportunity to get tested, and we can start to identify, again, where the negatives, the positives, and then in addition to that, which I'm really excited about too, is we're doing the serology testing. So that's a really important component of this too, and the Department of Public Health and Dr. Badati and her team have been really instrumental in kind of doing testing both, so that we can better understand the virus, how it impacts, identify maybe individuals that have had it and have recovered. And so that will also help us identify a potential workforce and get these workers back into the job. And again, starting to open up Iowa in a very safe and responsible manner.
Governor, you said that this could be upwards of 500,000 tests made available. So what is the new initiative bringing in terms of sheer numbers of tests right now? And then secondly, can you talk more about the assessment? They talked about looking at symptoms, exposure to the virus, and if you've traveled to a hotspot, and it sounded like asymptomatic testing would be later on. So I'm kind of trying to understand how this is going to expand the criteria of what the state lab is already testing.
Yeah, so what it does is our partnership with Test Iowa and Nomi Health, we have 540,000 tests. That's part of what we've been able to secure. In addition to that, they'll do the marketing, the website, the outreach, the data. So that's all included in the partnership that we have with them. Hey, if you guys need to add anything to what I'm saying, don't hesitate to step in, because I don't want to misrepresent something. So I'm not sure how we're going to coordinate that, but does anybody want to talk about your end and what it's providing?
Yeah, this is Mark Newman from Nomi Health. So it's the 540,000 tests. If you do the math, it's around 3,000 tests per day for 180 days, so 90,000 tests per month. And we are preloading the state as well to make sure that if there is an opportunity to do more, that the testing kits are available. And this is to be able to drive the kind of long-term adoption of testing across the state of Iowa.
So the tests are, you have the tests right now?
That is what we have secured with them through the contract with them.
Are you going to do asymptomatic testing?
Well, so we are doing some of that with the surveillance testing that we're doing. Do you want to talk about that? So we're doing some of that, and this would be a part of it in the manner that we would be able to use this testing capability through some of our processing plants. That's why we want them to go online and actually take the assessment, and that will help us identify some of those.
Yeah,
Thank you for the question. I think just like all along, the way we've looked at the resources available and how to make best use of what we have, that's what we're going to continue to do. And so again, I want to reiterate the department's commitment to stopping the spread of this virus and really taking care of our most vulnerable populations. And again, sharing information as we get it as quickly as we possibly can. And so having a tool like this helps us be flexible in understanding where the needs are in Iowa so that we can respond quickly and direct resources to those particular areas. And we'll continue to adjust those things as we go along according to what the needs are here in Iowa.
The test going through the state lab?
Yeah, yes, yeah.
Governor, so Mark said that there are opportunity to do more test kits. Is it your hope or expectation that the 540,000, once we go through those, that will be enough testing done to be able to make those big decisions that you're talking about?
That is going to have a significant impact on our ability to test those that need to be tested and to really understand where the state is doing well, where some potential hotspots are at, where are we seeing some clustering. The other piece of this is it will allow us to see that early so that we can get in there with the Department of Public Health and start to do some of that contact tracing and some of the research that's a huge component of this as well. So if you talk to states all across the country, everybody is trying to figure out a way that we can responsibly and safely open back up our economies and get Iowans back to work. And so this is a significant piece of that, to be able to understand who's testing positive, who's testing negative, where the hot spots are at. It allows us to be more targeted in our response, and areas that are doing well to open that up, but to still monitor it. People can go in and take multiple assessments. So even though you've taken, I believe that's accurate, right? Even if they've taken it once, we want them going back in if they develop symptoms later on. So you have the ability to go in multiple times and take tests based on kind of your symptoms and how you're feeling. And so,
Thanks, Governor.
Yep.
This is Josh from Domo, and one of the other things I wanted to say is, first of all, it's probably important to call out. There's not a lot of states are in this position. We talk to a lot of different states and sell software in a lot of different formats, and there's many states, are struggling to get 400 tests, 800 tests, 1,200 tests a day. So getting this kind of throughput, I think, can really make a difference. And then the other component here is it's not just the test, it's the assessments that happen.
Right.
And being able to get information and as people come in, understanding their symptoms and having that in a database that allows Iowa to, again, like you said, understand where those hotspots are is really important. But this definitely catapults Iowa into the upper echelon of states that are able to do assessments and tests across the population. So, really applaud the way you're leading forward here. I think this is going to make a big difference.
Yeah, I can't reiterate that enough. The assessment is a big component of this. So thank you, Josh, for bringing that back up and just highlighting that again.
Governor,
Thank you, Governor. This is Dave.
1 second. Okay, and then I'll, just 1 second.
The Black Hawk County.
Just 1 second.
Sorry.
I'm going to go, I promise I'll go to you. Okay, Dave, I think.
Yeah, apologies, it's a little hard to do this remotely, but
Yeah, I know.
one other thing to note, there's two components to the assessment. There's the initial assessment that it's critical that everybody in the state participate in, but we reference this, but I want to make sure everybody captures the importance of this. There's a daily check-in, and which is a really shortened version of the assessment. It's like a 1 to 3 minute check-in, and it's just you receive a text, you receive an email, and with that you just give a quick update of your health, your health status. Is it getting a little bit better? Is it getting a little bit worse? And what that allows this program to do is it allows the state to know exactly where everybody's at, be able to, as we mentioned, move and adapt the tents and the testing. But it also really empowers everybody in the state to be in control of their own health. And so it'll prompt them. It'll say, hey, this changed, but it appears as though you've increased your symptoms, and now you have also a stuffy nose and you're achy. This suggests you should actually go engage with your primary caregiver, or hey, if you need to talk to a telehealth doc right now, we can connect you. So this is both an acute, let's address the problem right now, but it really will support a long-term and ongoing management of this virus over the next 12 months. Because look, I think we all want it to go away right now, but we all know this is going to be a process, and we're learning as we go.
Yeah, that's a really good point, so that we're prepared not only to, get through and start to open things back up, but to be prepared in case we do see it start to spike again. So thank you, I appreciate that.
Black Hawk County health officials want enough test supplies to be able to test asymptomatic people. They say right now they're not allowed to with what they were given by the Iowa Department of Public Health. With the huge spike in cases in that county in the past few days, when will they be allowed and be given the supplies to do that?
So who is saying they're not getting enough testing capacity?
The Black Hawk County Public Health Director.
Well, they need to go through the Department of Public Health. We've made it very clear that we're willing to get, and we have the capacity to get the testing there. Now, there's different ways that they can do that. We've provided tests to 3 clinics, I believe, in the area, so they have the opportunity of going there to get the testing done. But we continue to work with communities and businesses and long-term care facilities all across the state. So I don't know if you have anything to add to that.
No, I think it's just another example of, again, as we've learned more about this virus and understood ways to target resources in conjunction with the assessment that we're talking about through Test Iowa, if we can understand, even for somebody who doesn't have symptoms, what their risk factors are, that again helps us further direct the resources we have and helps us do a couple of things, right? All the time we're trying to do things like get a better understanding of what people's symptoms are and the disease activity across the state of Iowa, which people who choose to share their information through the assessment helps us do. Then we also want to direct resources and increase testing to help us understand, confirmed cases and lab results associated with the illness, right? And then we also want to try and continue to implement those public health measures, which we're always going to recommend. The regular personal protective measures and measures like staying home are going to continue to be important, no matter what illness we're talking about, and they're going to continue to be an important part of the response to COVID. And having more information like this allows us to further direct those resources and efforts.
Yes, Josh, I missed an opportunity. They should go and do the assessment, and that will help us accomplish exactly what they're asking for. So I am going to get so much better at this. This is a pivot from what we've been able to do, and this is how valuable this tool can be. So we can say to those individuals and that whole area, Waterloo, every individual there in Black Hawk County can go online to testiowa.com, and they can go through an assessment, and we can start to figure out who is symptomatic or how we can start to schedule and walk through the testing. But it is essential. This is the first thing that they can do, and this is the first thing Iowans can do if they're concerned about an outbreak in their area, or they want to just, be proactive and, what did you say, kind of be in charge of their own health. Go online to testiowa.com, take the assessment. We'll collect the data, and then we'll start to put in place the strategies to take the next steps and see how we can start to really identify where some of the hot spots are and what we need to do next. So take the assessment.
Aaron Murphy, go ahead.
Governor, just real quick, can you, and I think you may have touched on it, but can you assure Iowans, because this is a publicly traded company that's asking for individuals' health care information and data, can you expand on how that will be kept safe and confidential?
Yep, and I'll have somebody on the team too step up and say it also, but we own the data. It is secured by Qualtrics. It's analyzed by the state public health. Again, it is protected, and Qualtrics meets the highest standard of security. It is an ISO 27001 certification. We're also protected by HIPAA. So we have all of the protections in place. The information is confidential. Does Spencer, do you have anything else to add to that?
Yes. So the data is encrypted. The data is encrypted at rest and in transit. And as the governor stated, we are high trust and FedRAMP certified and HIPAA compliant. Work with public sector and have for many years. And at the end of the data is owned by the state, so we don't have access to it.
We're going to go to channel 13.
Go
ahead.
Go ahead.
Yeah, Governor, one other thing to note on the data, because this is an important thing. Once an individual puts their information in the assessment, so as you take the assessment, there's the general overview, and then you put in some personal information, and then after that, the health questionnaire proceeds. After the point that personal information is put in, that individual, through the existence of the testing process, that information is obfuscated, and no one associated with Test Iowa can see it. At that point on, you heard about the QR code. An individual at that point is purely a QR code through the entire process. This system is a processing system. It is not a data system. All of the reporting comes out of the state database because, this is not designed to provide any of that kind of information. It's secured. It's never visible. And really all of this data has been put into the centralized state database where all of that reporting and any of that kind of information would reside.
Thank you. Very good information.
Go ahead, Channel 13.
Good morning, Governor. Can
Hi.
you all lay out specifically this enhanced testing ability? Will then it allow more people to qualify to get tested? And then secondarily, why the launch now? Would you have done this previously to expand testing if you could have acquired the testing supplies? Is it as simple as that?
Well, yes, and I'm the second state in the country to be able to do it, and so I'm excited about the opportunity. I've already, Pete Ricketts, the governor of Nebraska, reached out to me and wanted more information about it. Our chief of staff had connected. We've talked about the contract and what we were able to do. So you're going to see another Midwestern state that's going to be launching and up and going, and actually we'll be able to coordinate some of our efforts as well with him coming on board with that. So we're excited about that. But, and this has just been evolving. And we have been able to acquire more tests, but this is, I think, it looks longer term by being able to allow Iowans to really manage their own health. And so this will be very helpful as Iowans go online and take the assessment and we start to see, where some of the hot spots are, where we're seeing clusters, where we're healthy, where Iowans have done what they were supposed to do by following the directions that the Department of Public Health has put in place from the very beginning of this outbreak. And so this will really help us assess some of that data, that information, not only from a statewide perspective, but from a regional perspective, right down to a community perspective, right down to a zip code. So we are really going to be able to, I think, use this in a manner to not only watch and monitor, but to continue to look for, use the data and the information to also open Iowa back up. And that's critical, not only the assessment and the data and getting the testing, but also the contact tracing is extremely important too, to be able to get in front of this quickly and start to, slow the spread and really limit the scope, the potential scope of what we're seeing in some of these hot spots.
Ron at KWW, I'll go ahead.
Governor, good morning. 2 weeks ago, Blackhawk had 12 cases. Today, 366. All are being traced now, and most of them back to the Tyson plant. So I think everyone realizes, Governor, that you're in a very, very difficult position when it comes to calls to close a plant like Tyson's in Waterloo with 20,000 hogs a day in an industry already being really hurt. It's kind of an actuarial decision. You're weighing the negative economic impact versus the potential risk to public health. So tell us why you still think it's worth the risk to keep that plant open.
Well, first of all, we want to make sure that we're protecting the health and well-being of all Iowans. And I want people to know that probably, 50 to 70% of the United States population is projected to get this. So people are going to get it. It is very contagious, especially in large gatherings. So our goal, and 80% of the individuals that get it are only going to experience mild or no symptoms. So we shouldn't lose sight of that as well. So we really need to focus on the individuals who are vulnerable, who have underlying conditions, and do everything we can to mitigate their exposure, to stay home, to limit, trips to essential trips, to do what we can to flatten the curve, which we're working on so we don't overwhelm the healthcare system. And so, by going in and being able to have Iowans across the state take the assessment, again, see where they're at, use a strategic testing and follow-up, we can start to identify, start to do the contact tracing, see the scope of who has been involved, and most importantly, make sure that we're taking all precautions necessary to protect the health and well-being of our workforce, but also to get them through the incubation period and then back to work. And so with the serology testing, that's going to be extremely helpful because we'll be able to identify. A lot of times Iowans don't even know that they've had it. And I think we're seeing more and more numbers indicate that that's happening with the percentages that I just talked about. So this will be an opportunity for us to also see if Iowans have had it, if they've recovered, what their immunity is. We're still learning that. We don't have all the answers there. But then that starts to go into some of our projections about bringing our workforce and standing them back up. up. So we're working with the facilities to make sure that they're taking all precautions that they should to protect their workforce, masks, face shields, sanitizing the place. They do this and have done this on a daily basis. That's standard practice. Making sure that they're doing screening before they even enter the plant, taking temperatures, limiting the breaks and how, separating the employees, partition shields that they're putting in place. So they're doing that, and then we need to work with the workers to make sure that we're doing an assessment, see if they are showing any symptoms, that we're getting the test done and getting them on the road to recovery.
Adam at KCRG.
Governor, you've noted the particular danger facing Iowa's long-term care facilities, 51% of the deaths in the state. But the state right now is still choosing to only name places with 3 cases among residents. Florida recently made the choice to do that in the interest of transparency, to identify all long-term care facilities that have even 1 case. Can you explain why you're still choosing to only identify the 3 and not identify all of them?
Yeah, thank you for the question. I think that the information that we're sharing about when we confirm an outbreak that's associated with a long-term care facility has to do with part of the epidemiologic investigation to understand where the risk is. So unfortunately, as we've known for a while, this virus is widespread across the state of Iowa. And so when we're alerted to a single positive case in a resident or in a staff member in a long-term care facility, we do initiate all of the preventive measures and offer all of the support that we can, even from that first notification, and start to work very closely with the facility. And again, this is what we're doing all the time to help understand the risk factors and how we think somebody may have become sick, and to implement the control measures that we need to implement to reduce spread. And so the idea of using 3 individuals, 3 residents in a facility as a determination for confirming an outbreak really has to do with understanding the risk and understanding what's going on in a facility. And it's something that we continue to do. We continue to work very closely with these facilities on. We're going to keep doing that, not just for COVID, for all kinds of illnesses, for the health and well-being of the Iowans in these facilities. And I would also say that just like with plants, or any other location, these are all a part of our public health, where Iowans live and work and where we get care and what we do for leisure. And so we always want to make sure that we're sharing information, not just when people have problems, but to help prevent problems from occurring.
So that defines an outbreak, but why not just make all of that public when cases are revealed in any long-term care facility?
I feel like you answered it, but.
Yeah, again, thank you for the question. I think that's currently, the way that the department is sharing that information, and I appreciate the question. And as I said, we're going to continue to work with these facilities and share as much information as we can, as quickly as we can.
But again, we're going to have them go in and take the assessment so that we can start to get in front of this. We have strike teams that are going into the nursing homes to make sure that we're working with the facility and the staff to make sure that, we're meeting their needs and they're getting the information that they need. And so taking the assessment, getting in front of it, identifying who's positive, who's not, so we can do the contact tracing is all key to really preventing this. And they have been very proactive from the beginning, but once it gets into a facility, it is really hard to contain it. And so we're trying to get on the front end. Public health has been very transparent and to try to be very transparent with the data that they're providing, continuing to look for different ways to provide Iowans with the information they expect. So I want to commend them on the work that they're doing on a daily basis to really protect personal information, as well as trying to provide the public with the information that they need. And it's always tied to, the health and well-being of all Iowans. So I really appreciate the work that they do every single day on behalf of Iowans.
We got time for one more question. Caroline's asking on behalf of another reporter.
Kay Henderson is wondering why it was said that it comes at little to no cost to the individual to get these tests. How much does it cost, and who is keeping that money?
So we signed a contract with them, and the contract provides, is that what are you asking? Let me make
About
sure.
the cost of the test, if there is a monetary
There is
value.
no cost to the individuals
Well, they
taking the
said
test.
little to no cost.
Well, there's no cost to the individuals that are taking the test.
Okay.
I mean, we're standing it up, and this is what we're going to use some of the federal COVID money for this very thing, because we know it is critical to really understand the health and of Iowans, to do the assessment, to understand where the outbreaks are, and then to be able to target our response as well as getting in front of it. So, they've got cutting-edge equipment that they're going to be able to use and allow us to do that. Not only the assessment, the testing, and then the follow-up.
On the block grant money, just
Yeah.
because you mentioned it,
Yeah.
can you talk a little bit about what other guidance you've received about using
We're
that money?
hoping that we can still get that, so it's coming, but they've promised that they would provide as much flexibility as possible, and it needs to be tied to addressing COVID, and this is tied to addressing COVID. So before I wrap up, I just want to again say thank you to the team in Utah. You've really turned this around really quickly. I cannot even express my gratitude on behalf of Iowans to get out there and do the assessment and follow through, and I really I look forward to reporting out how we're able to really implement the great tool that you've provided for us. So thank you very much, and thanks for taking the time to be on
you,
today.
Governor.
Thank you.
Thank you.
Thanks, everyone.
So we don't have to, I will request all the records. Okay, we'll just, okay. But they said that they're only allowing them to test symptomatic people.
We'll reach out to